That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at the question 25. You hear a monologue by a physician explaining about lupus disease. Now read the question. Lupus is a chronic autoimmune disease in which the immune system becomes hyperactive and attacks healthy tissue, resulting in such as inflammation, swelling, and damage to skin, joints, blood, kidneys, the heart, and lungs. Normally, our immune system makes proteins called antibodies to protect and fight against antigens such as bacteria and viruses. However, lupus makes the immune system unable to differentiate between the healthy tissue and antigens, which leads the immune system to direct antibodies against the healthy tissue instead of antigens. Question 26. You hear a discussion between a doctor and a nurse on leukopenia disease. Now read the question.
Hello, doctor. Can you explain to me what is leukopenia disease?
Well, leukopenia is a condition where the patient has lesser white blood cells in their bloodstream, which is diagnosed with a blood test called a complete blood count. There are 5 types of white blood cells, and each of them protects the body from a different kind of infection. Neutrophils make up 55 to 70% of total white blood cells, and they fight off fungal and bacterial infections. Lymphocytes protect the body from viral infections. Monocytes are the largest of the white blood cells, and they fight against bacteria, fungi, and viruses. And they mend tissue damaged by inflammation. Basophils are involved in inflammatory reactions to allergens. Eosinophils fight parasites and play a role in allergic reactions and conditions, such as asthma. Question 27. You hear a discussion between a doctor and a nurse on different stages of gout. Now read the question.
Hello, doctor. What are the different stages of gout?
Well, there are various stages through which gout progresses. In the asymptomatic hyperuricemia stage, the person will elevated uric acid levels without any outward symptoms. The acute gout stage occurs when the urate crystals suddenly cause inflammation and intense pain. This condition is also called flare that can be triggered by alcohol and drug usage, stressful events, and due to cold weather. The intercritical gout is the period further urate crystals are being deposited in tissue. The main difference between gout and pseudogout is that the joints are irritated by calcium phosphate crystals instead of urate crystals. Chronic tophaceous gout is the most debilitating stage. Permanent damage might have occurred in the kidneys and joints. The patient can also develop tophi, big lumps of urate crystals in joints of the fingers. Pseudogout is the condition that is confused with gout. Question 28. You hear a discussion between a doctor and a nurse on different types of gum graft surgery. Now read the question.
Hello, doctor. What are the different types of gum graft surgery?
Well, there are three types of gummed graft surgery. In the connective tissue grafts, the periodontist removes tissue from the roof of the mouth by making a flap and taking tissue from underneath the top layer, stitches the tissue onto the existing gum tissue to cover the exposed tooth root, stitches the flap on the roof of the mouth from where they took the tissue. The gingival grafts is preferred for the persons with thin gums that require extra tissue to enlarge the gums. In this method, the periodontist removes tissue directly from the top layer of tissue on the roof of the mouth and stitches this tissue to the existing gum area. Pedicle grafts method is often preferred for the individuals having lots of gum tissue growing near the exposed tooth. The periodontist grafts tissue from the gum around the tooth requiring treatment and partially cuts away the tissue, keeping one edge attached, and stretches the tissue over or down, covering the exposed tooth root and holding it in place with stitches. Question 29. You hear a discussion between two doctors about medical conditions that cause undigested food to appear in the stool. Now read the question. Doctor, please, can you explain medical conditions that cause undigested food to appear in the stool? Well, if a patient is having pancreatic insufficiency, it means they lack enzymes resulting in the inability to break down the food. Crohn's disease is a type of inflammatory bowel disease that causes inflammation in the digestive tract that can result in severe abdominal pain, diarrhea, and malnutrition. Celiac disease is an autoimmune disorder where our body becomes incapable to digest the protein known as gluten that is found in barley, wheat, and in certain other grains. If the digestive system of a person has lactose intolerance, then it becomes incapable to break down the milk and dairy protein. Irritable bowel syndrome is a common condition that affects the large intestine, resulting in pain, bloating, diarrhea, or constipation. Question 30. You hear a discussion between a doctor and a nurse about different procedures to detect blood clots. Now read the question.
Hello, doctor. What are the different procedures to detect blood clots?
Well, a D-dimer blood test will measure a substance in the blood that can determine whether there is abnormal clotting activity somewhere in the bloodstream. Cardiac biomarker blood test is a blood test that can detect damage to the heart muscle. Compression ultrasound is a non-invasive test that can be performed and is often very useful in diagnosing deep vein thrombosis. Angiography or venography and catheterization techniques in which a dye is injected into a blood vessel where a clot is suspected, X-rays are also used to detect the clot. Echocardiography uses sound waves to get images of heart and are often used in patients who have had embolisms affecting an artery, especially in patients who have had an embolic stroke. A ventilation perfusion scan uses a radioactive dye to investigate blood flow to the lungs and can detect whether a pulmonary blood vessel has been blocked by a pulmonary embolus. CT scan is often the first test used to diagnose a stroke, but is also useful for confirming a pulmonary embolus. MRI scans can be used to detect clots in blood.